another episode of the On with Amanda Medicare podcast. Today, we are going to pick up where we left off our last episode, which was a review of Medicare Part A and Part B, so that traditional Medicare or the foundation. And today, we're going to explore the other options that are available to address original Medicare's out-of-pocket costs, and finally talk about Medicare Part D. So I want to go back to the slide that we used before in our last episode. If you happen to miss it, this episode is going to make a lot more sense if you've already watched that one. So go back to episode 1, Medicare Basics, and then come back and join us. But we're going to jump into it. Okay, so hopefully this looks familiar. This is the content that we discussed last time, that original Medicare or the traditional Medicare part, complete with costs, coverage details, and out-of-pockets. Today, we're going to fill up the rest of this worksheet as we talk about the additional coverage options that are available to Medicare beneficiaries who have Part A and Part B. So we're going to pick up where we left off last time. I'm going to start in this quadrant down here. And what we're going to talk about first is Medicare supplement or Medigap insurance. Now, everything that we're going to talk about after the original Medicare piece is going to either replace original Medicare's costs, or it's going to enhance or supplement them as a secondary coverage. Anything that we talk about having an additional cost would be in addition to the Medicare Part B premium. So it's not like if you enroll in something, you get rid of having to pay that $185. And I just really want to take this time to thoroughly explain how Medicare with a supplement is different from Medicare Advantage, which we're going to explain over here. So here we said we're going to start Medicare supplement or Medigap insurance. Medicare supplement or Medigap are private insurance plans that you would buy from an insurance company. These are plans that are going to work as a secondary payer after your original Medicare pays primary. So when you add a supplement, you're still keeping traditional or original Medicare in the driver's seat. Your providers are still going to bill Medicare A or B. Medicare is still going to process that claim and pay benefits on your behalf. It's just you would have this additional secondary coverage to step in and help reduce these costs. Medicare supplement or Medigap plans are going to help with all, most, or some of these out-of-pocket deductibles, coinsurances, and copays that original Medicare would ask you to cover. It does work as a secondary. So if you have a Medicare supplement plan, your provider network is still any Medicare participating provider. Pre-authorization rules, coverage rules, preventive and wellness coverage, those are still all based on traditional Medicare's rules. And Medicare is still going to be part of the equation in that they're processing those claims and still paying benefits on your behalf. All of these Medicare supplement plans do have additional monthly premiums. So you're paying an additional amount so that your secondary coverage can reduce your out-of-pocket costs. One thing that sometimes people don't realize is that the coverage rules and the prices for Medicare supplement, Medigap plans are very state specific. So I work in New York. In New York, we have some extra protections for Medicare beneficiaries, like guaranteed issue, so no underwriting requirements for a certain period of time. And you would see if you were to compare prices from other states that do allow underwriting, that our premiums are a little bit more expensive, but that's because we get to enjoy that full coverage of that plan. So this would be one option. You'd have traditional Medicare A and B, you'd have your supplement as secondary, and I am going to show a helpful graphic that will show the different plan levels and what of these deductibles, copays, insurances, and coinsurances they cover. One thing I do want to talk about too is this idea that if you don't have Plan F, you can never have Plan F. So Plan F is a very high level of Medicare supplement plan. It literally covers every single cost out of pocket that Medicare Part A and B would ask you to cover. Starting in January of 2020, there was a change to the Plan F coverage rules. Anyone who was eligible for Medicare A or B prior to January 2020 can always enroll and have a Plan F coverage. Anyone who started Medicare after January 1st, 2020, the highest level of Medicare supplement plan that you can have is Supplement Plan G. And when we show you the graphic, you're going to see the little differences between those two coverages. So that's hopefully a good review of Medicare Supplement or Medigap as your secondary coverage to original Medicare. I still haven't said Part D. Amanda, just tell me about the drug coverage. So with Medicare Supplement, because those only cover the costs that original Medicare would ask you to cover, and original Medicare does not cover prescription drugs. When you add a Medicare Supplement plan, we have to add what's called standalone Part D, which is just the D for drug or prescription component of Medicare. There are always several different carriers and plan options that are available to Medicare beneficiaries depending on the county that they live in. You'll see that those Part D plans are going to have an additional monthly premium, most likely deductibles, and you'll also see that when you fill medications and you give them your Part D card, depending where on the formulary your Part D plan has priced that medication, that's going to dictate whether you have a copay, what that copay is, or if you have a coinsurance for that specific medicine. So it's really important to work with somebody or utilize the Medicare.gov software to price your specific drug list. So the specific medications that you take, you can even boil it down to the specific pharmacy that you use so that you know this is the best option for my coverage. It's going to take into consideration my premium, the deductible if it's applicable, and what my copays will be for those medications. And you'll see that you actually have a month-by-month summary of exactly what to expect for your prescription drug costs. So this is the first option that's available to Medicare beneficiaries. You keep original Medicare in the driver's seat. You purchase a Medicare Supplement or Medigap plan, right, to fill in those coinsurance, copay, deductible gaps that original Medicare would leave you responsible for. And we solve the drug equation with Part D separately. The other option is called Medicare Advantage. I put that up into this side. And again, if someone's here in my office and we're going through this from the beginning, I actually write this out on a yellow pad. People keep it, they bring them back from year to year. We just update the numbers, so it's kind of fun. But I put Medicare Part C or Medicare Advantage on this side of my worksheet for a very specific reason. Medicare Advantage plans are private insurance. So you'd pick one specific plan with one specific insurance company. But what's going to happen is this plan doesn't work in conjunction with original Medicare. It replaces original Medicare's responsibility. Whoa, that sounds scary. Let me explain. So when you enroll in a Medicare Advantage plan, from that plan effective date forward, your providers aren't going to bill original Medicare. They're going to bill the insurance company that you've chosen for your Medicare Advantage plan. So this benefit schedule, the deductible, the coinsurance, copays, this doesn't exist anymore. You have to have Part A and you have to have Part B, and you have to pay your $185, but Medicare is going to shift the responsibility to that insurance company to administer and provide your health insurance benefits. So really, it takes hospital, medical, and Part D prescription drug coverage and puts it all into one plan. In addition to that $185 per month Part B premium, you will see that some of these plans may have a monthly premium, but there are also a lot of zero premium options. How is that possible? Over here, we're talking about additional costs for Medicare Supplement, additional costs for Medicare Part D, but it is true. There are plans that don't have additional premium. The reason that they're able to do that is because they are collecting this $185 that you pay for Part B. Medicare says we're out of the payment responsibility, you're going to handle it, so they send them that money. If we talk about zero additional premium compared to plans like Medicare Supplement that does have, monthly premiums, I do want to just explain how these coverages are different. So one thing that's unique about Medicare Advantage is that typically there's no hospital or medical deductibles. You would see that the prescription component of the Medicare Advantage plan may have some deductibles. I typically see that they're a little less than the deductibles over here on standalone Part D. But with Medicare Advantage plans, you typically don't see deductibles for hospital and medical coverage. There are copays for most services. So that's really the difference between Medicare Supplement and Medicare Advantage. Medicare Supplement is going to have monthly premium, but it's going to cover most of those out-of-pocket costs. Medicare Advantage is the opposite. So probably no additional premium costs, but more costs out of pocket as you go. And that's really as bottom line, simple as I can make the distinction between the two. If you were to look at your Medicare and You book, usually comes out in the fall. It's a big book. Usually I tell people to throw it away. It's not very nice. It does have a lot of information in it, and you'll see every plan for Medicare Advantage that's offered in your area and some of the typical copays. So a primary care specialist copay, what you'd pay if you were admitted to the hospital, do they cover blood work, what would you pay for a one-day surgery? All those things are spelled out in the plan comparison. If you're sitting with a Medicare advisor or broker like I am, we would go through those details so you would know when you do need to use the plan, exactly what the costs would be that are associated with that. I will mention that preventive and wellness services are covered in full. So we talked in the last episode about how Medicare does cover preventive and wellness services without being subject to the Medicare Part B deductible. It is important to know that the same services and the frequency with which you can have those preventive services with Medicare Part B have to be covered by your Medicare Advantage plan. So if you had questions about whether something is covered under preventive, you could still go to the same Medicare.gov site to see what the frequency and the services covered under preventive are. In the last episode, we talked about how Medicare Part A and B, so just the traditional Medicare on its own, doesn't have a max out-of-pocket feature. So there isn't a point in time where you've paid enough 20% or enough hospital deductibles that Medicare would cover everything. Adding the supplement is really what addresses that for you if you're on this side. But over here, Medicare does oversee these plans, CMS, Center for Medicare Services, and they do require that these plans do tell you what your max out-of-pocket is. So it does not include premium, and it does not include prescription copays. But anytime you pay a hospital or a medical copay, the plan is going to keep track of that. They'll send you a statement, your explanation of benefits. And if your copays happen to accumulate to the plan's max out-of-pocket, then they have to cover 100% of your covered services for the remainder of the year. You wouldn't have to pay any more. So that, compared to just traditional Medicare, is a benefit of these programs. Another thing that a lot of people like about Medicare Advantage is that they do offer value-added additional services. That's the official term. Sometimes I just call them extras. Value-added additional services offered through Medicare Advantage programs are things such as gym benefits, maybe some dental, either preventive or some comprehensive dental, routine eyewear and hearing coverage. So like a routine eye exam, eyewear allowances, routine hearing and hearing aid allowances. I do want to state that any medically necessary hearing or vision services that you need would be covered under the medical portion. So there's no significant difference between that. It's really just those eyewear allowances that unfortunately don't exist with original Medicare Part A and Part B. And then when someone likes the way that Medicare Advantage is going to cover them, they like that it's probably not an additional monthly premium cost, that they have a cap on what their costs can accumulate to. They like those value-added additional services. It's really important to know how your Medicare Advantage plan is built. So is it a PPO plan or is it an HMO plan? I want to take a minute and explain the difference between those two plan types. So PPO stands for Preferred Provider Organization, right? Boring jargon. Really what that means is that plan has created a medical network, hospital network, and you can see providers who are contracted with that plan and pay in-network rates. It also would offer you out-of-network coverage, almost always at a higher cost to you, as long as those services are medically necessary. So in-network, pay lower in-network rates, but still have coverage out-of-network. Some PPO features also will open up your provider network to a national network. So for a member in New York and a member in Florida with the same Medicare Advantage company, they typically would allow you to see providers in both of those areas who are contracted with that plan and pay in-network rates even though you're in a different part of the country. An HMO plan works quite differently. So an HMO plan, you would have to see in-network doctors unless it's an emergency or an urgent care need, and I'm going to come back to that important point in a moment. HMO says you have to see doctors who are contracted with our plan or you don't have coverage. So if it's an emergency or an urgent care need, you go seek care. There's no in-network, out-of-network question. If you wanted to see a doctor for a second opinion, or if you were traveling perhaps and couldn't find a doctor who was in the network, that would be an out-of-network cost, and you would have no coverage for that. So PPO plans do tend to be a little bit flexible. I think you just want to have a really good conversation about what the national network looks like for that plan, specifically areas that you may frequently visit. But also just know if out-of-network benefits are important to you, that would be more of a PPO feature. So this is a lot of information. I appreciate that. I usually make a joke at this point that if someone had come in and sat in my office and this was already all spelled out on my yellow pad, they'd probably turn around and walk right out the door. I think that's fair because it's a lot of important information. It's detailed. What I really want this episode to be is just a solid understanding of how adding Medicare supplement and separate Part D is different from a Medicare Advantage type solution. And hopefully we accomplish that. So today we talked about the additional insurances that are available to you when you have Medicare Part A and Part B. Probably the most common question I get is, yeah, but which one is best? Which one should I have? I think it's a very good question. I just feel like it's a different answer for everybody. But what a Medicare broker or a Medicare advisor, or hopefully what this podcast is going to help you do, is really understand the pros and cons between both options, keeping original Medicare and adding a supplement versus Medicare Advantage, so that you can look at things like monthly budget, the needs and the medical uses that you typically have, so that you can just make an informed and empowered decision about which types of coverage is going to be best for you. Of course, if you have ideas or requests for future episode topics, please email them to info@imwithamanda.com, and I'll look forward to seeing you next time. Thank you. Thanks for listening to another episode of the I'm with Amanda Medicare podcast. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Also, please leave a review as that helps me reach more people that can benefit from this podcast's content. If you have questions or topics you want me to cover for a future episode, please email them to info@imwithamanda.com. I look forward to hearing from you. Like any good industry, we do have compliance requirements, so here's my disclosure. We are not a government agency. We are licensed insurance agents who discuss insurance programs such as Medicare Advantage, Medicare supplements, and Medicare Part D prescription drug coverage. Any specific plan information I provide is limited to the plans I offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Thank you.